committee for the kind invitation. This is a challenging case for a PVOD. This is a 64-year-old patient with a thoracoabdominal aneurysm involving the visceral arteries. So there were no major health issues. He had some previous consultation and the patient deemed to be inoperable. So when we met him in the first consultation, he had a 9.0 centimeter aneurysm. In the CT, we could see that he had the truncus was occluded and he got a retrograde filling from the SMA. The SMA was involved in aneurysm, the right renal as well, and the left renal was displaced caudally, and he also had the stenosis at the orifice of the artery. So the planning was originally to do a custom-made device by using fenestrations and a branch for the left renal. The patient appeared 2 years later in the emergency room with abdominal pain and low hemoglobin. There was an urgent CTA done. There was no rupture, but they found that he had a colon cancer bleeding from there, and he had no evident metastasis. So during the second consultation, the aneurysm had grew a little bit. Now it was 9.45. We thought about doing a laser in situ fenestration, but those proved to be logistically impossible. So we opted out for a T-branch, informing the family that the left renal was outside the instructions for use for a T-branch and with the risk of losing the left kidney. So this is the catheterization of the right renal and the SMA. This is the, we actually managed to put wires and catheterize the left renal as well. And we also did a PTA in the orifice. We went outside the T-branch and we tried to confirm that the truncus was occluded. And when we had this confirmation, we put a plug in the T-branch branch. This is the final result. And the cone beam CT performed. So the grafts and stents that were used are shown in the diagram, including the plug in the branch that was intended for the truncus. And this is the 3 months post-op CT. We can see that he has total occlusion of the aneurysm with no evident endoleak, and he is still undergoing surveillance, of course.